Hey everybody, it's Dr. Rosenfield again, talking today a little bit about varicose veins. Varicose veins are those big, bulging, ropey-looking blood vessels that oftentimes impact patients in their lower legs. And they can be treated, and not only can they be treated, but oftentimes the treatment is covered by insurance. The reason why this happens is that we are upright mammals walking around this earth, and gravity sometimes does not treat us very well in our legs. The heart pumps blood down to the toes, but the veins have to bring the blood back to the heart. And the way that happens in the lower leg is when the calf muscle acts like a pump to push the blood upward toward the heart. When that pump is working well, but the valves inside the veins are not functioning well, we get leaky blood vessels. And what ends up happening is the blood goes upward, but it also goes back down. If you can imagine the blood going up through a valve, but the valve is leaky, the blood can go down as well, and that causes the bulging veins. So what we do to get rid of that problem is we can basically eliminate all of the blood vessels that are essentially not working well in the superficial, the shallow part of the leg. We do that with a combination of procedures, something called a radio frequency ablation, where we put a catheter into a blood vessel, typically the great saphenous vein, which is on the inner aspect of the thigh. And the great saphenous vein is the major blood vessel that then dumps into the deeper system of the blood, of the circulatory system. And if we get rid of the great saphenous vein, oftentimes we can get rid of the underlying problem. We then can remove the obnoxious looking vessels that are near the superficial skin using a procedure called phlebectomy. And that's also a surgical procedure. These are both done under local anesthetic in the clinic. And finally, for cosmetic issues, we can do something called sclerotherapy or laser therapy, and that's typically for the superficial spider vessels at the level of the skin. So three main procedures: the sclerotherapy and laser are more cosmetic, and the phlebectomy and the radiofrequency ablation are procedures that are done under local anesthetic and are covered by insurance to take care of the incompetent vessels in the lower leg. We have some more information on our website about this. The company that manufactures the catheters that we use for the ablation is Covidien. The system is called Venus, V-N-U-S. You can look that one up as well. And the outcomes are fantastic. It's not very painful. And typically, in order to have this done, you come into the office for a free consultation for a duplex ultrasound. So basically, if you think you've got varicose veins, you can come into the office. We take a quick look with an ultrasound machine. If you do have the problem, we do a more involved ultrasound. We do bill that to insurance. Then you typically need to be fitted with some support stockings. And there's usually about a 3-month interval where you have to wait before insurance says that it's okay to go ahead and move forward with the ablation. And then we do the radiofrequency ablation in the office, and patients do beautifully. So if you have more questions, feel free to email us about it. Hope this was informative to you. You can always email at info@pearlwomencenter.com, or you can reach out to our office and give us a phone call, and we're happy to talk to you about it as well. Thank you so much.